Hi, I'm Betty Vajika, and I live in Kenyon, Texas, near Amarillo, and I have experience in foster care, and I'm 18 years old.
Hi, my name is Aminique Liggins, and I am a part of YALC. I am 18 years old, and I have been involved in the foster care system in Dallas, Texas.
Hi, my name is Montoya Thomas. I am 25 years old, and I am from Houston, Texas.
When I was in foster care, healthcare was pretty accessible to me. I had access to dental. I had a doctor that would do my annual checkups, and I had access to Medicaid or any kind of medication that I might need for my skin.
The medical part of my insurance, like if I need to go to the hospital, but when it came to dental, I had barriers when trying to get a tooth pulled or trying to get filling because yes, I am a former foster youth, but I still had to pay out of pocket.
While being in the foster care system, I had access to free insurance, superior health, and I was able to go to the doctor and get free medicine and free visits if it was the emergency room or if it was a doctor's office. I didn't have access to some doctors because they didn't take superior health. So doctors that I needed to see, like gynecologists and OB/GYNs, did not take my insurance. I have to say, important healthcare needs. I wish that my insurance would have covered me was allowing me to know when I get a certain age that I'll be transferred to another insurance for me to be able to enroll in the process of me re-enrollment for my insurance.
One of the barriers that I faced when aging out of care was I didn't know how to use my card. I didn't know what kind of benefits did I have.
I faced many barriers aging out of foster care, dealing with insurance. I didn't get the opportunity to be over my own insurance to where I could call and change my address. I would have to have someone else do that, which was very difficult because not everyone answers the phone for me after I age out. I wish that my insurance would have gave steps on enrollment, and not even just that, if there was a hotline for us to call for them to better assist us kids who aged out of foster care, because when time comes for us to schedule an appointment, we don't have insurance, and we wasn't fully aware that our insurance was going to switch over when we got older.
I was very depressed because when I can't sleep, if I'm dealing with tooth pain, and then it's just like, I have insurance, but it's like not really, I can't really utilize the insurance like I want to. Being homeless and everything, I had to eat whatever. And so it deteriorated my teeth. Because I'm already worried about what I'm going to eat next. And so I can't just cook a healthy meal at the moment. And so with that affects my teeth, then that affects my heart, that affects my health. And now I'm at more of a risk.
The information that would have been very helpful when I was aging out of care was knowing how to access my health benefits and where would I be able to access this and how would I get there for transportation wise. And I would have really loved it if they would have taught me how to go to the doctor's office and like show me how to ask if they take Medicaid or who can I go to take Medicaid.
I wish there was a guide on explaining insurance to us instead of giving us the paperwork that they give adults. It was very hard to understand a lot of the words that was on the paperwork. I wish there was a guide for us to re-enroll into insurance after we change addresses time to time. And I wish that we were able to change our insurance ourselves. Not some of the times, only the caseworker can change the insurance because they're the co-responder on our insurance. and we have to get in contact with them. And most of the time when we age out, they're not there to answer the phone or have time to, do those steps for us.
I wish it was covered for the tooth pulling once you turn 21, after 21, because I know they cover a lot of things up until 18. I just wish they would cover the dental part.
I just wish that the PAL organization would teach more on it and help us walk through the process on how to access and use up health care.